Hi. There are several types of mood disorders. The most common ones are major depressive disorder, bipolar disorder. A few others are dysthymic disorder, cyclothymic disorder, mood disorder due to a general condition, and substance-induced mood disorder. For purposes of time today, I'm going to focus on major depressive disorder and bipolar disorder primarily. I wanted to just start with prevalence. How often does this happen? Approximately 20.9 million American adults, or 9.5% of the adult population every year, have a mood disorder. The two major ones are major depressive disorder and bipolar disorder. Major depression is the leading cause of disability in this country every year. 14.8 million adults, or 6.7% of the adult population, have major depressive disorder. Bipolar disorder is a little bit less common, 5.7 million adults, or 1.5% of the population. Your chances for development of a mood disorder are unrelated to your ethnicity, education, income, or marital status, but does have some attachment to your gender. Major depressive disorder can happen at any age. The median age is 32 years old, which means that that's the one in the middle. And a lifetime chance, the amount of time that we have, or the chance that we have of developing major depressive disorder over our lifetime, for women is 10 to 25% of the population, for men is 5 to 12% of the population. And there are some theories that's probably related to hormone fluctuations being more pronounced in women than in men. Bipolar disorder, the median age of onset is a little younger, about 25 years of age, and the lifetime chance of development is lower, 0.4 to 1.6% of the population. Now, talking about, a lot of people want to know, well, what causes a mood disorder to happen? Why do people get mood disorders? And I'm going to refer to my model a little bit. Generally speaking, the most accepted theory is that a chemical imbalance is what's really happening for a person who has an affective disorder. When I'm looking at the model, what happens is that a person who has a mood disorder, everybody's brain communicates from nerve ending to nerve ending by sending neurotransmitters from one nerve ending to the next. And what seems to be happening is that people's nerve endings may either have too many neurotransmitters or too few. And what that does is it causes people to no longer be able to control their moods. They have a harder time making those moods more stable. What you want to see, and what a lot of the treatment for major depressive disorder and bipolar disorder are going to do, is it's going to cause that to regulate. You'll have the right number of neurotransmitters, or the receptors over here will be blocked to allow the right amount of neurotransmitters in and out. There is no single cause, but many factors seem to be working together to produce or increase the risk of a person developing a mood disorder. It's likely that genes and other factors in the environment work together to make a mood disorder develop. What they have found through as functional MRIs and PET scans have developed, what those are suggesting is that brain development may actually be playing a role in unstable moods later in life. It does tend to run in families. Children with a parent or a sibling with the disorder are 4 to 6 times more likely to develop a mood disorder. However, it's important to note that most children with a family member with a mood disorder will not actually develop a mood disorder later in life. Just the 4 to 6 times more likely, which is higher, but not every child who has a parent or a sibling with a mood disorder will develop that. Another interesting fact is that identical twin studies are showing us that 2 identical twins, one may have a mood disorder, the other one may not. That's a very important finding, because what that tells us is that it's not entirely genetic, and the reason that we know that is because identical twins share all of the same genes. And that really does push forward the idea that there is an environmental factor in the development of mood disorders. It's also important to note that certain things like a death in the family, other stressful things like losing a job, a divorce, all of those can trigger, in the environment, they can trigger the development of an affective disorder. So a lot of people ask, how do you know if there's a diagnosis of major depression or bipolar disorder or one of the other affective disorders? In the field, we use a book called the DSM-4-TR, and that actually has some criteria that we use to look at a person and the symptoms that they're having and decide whether or not those symptoms meet the time frame necessary and the severity necessary to create a diagnosis. It, however, is very, very important. One of the things that is always important to remember when thinking about diagnosing mental illness is that without dysfunction, there is no diagnosis. So all of us, just through human experience, are going to, at times, have certain numbers of these symptoms. And I'm going to talk about the symptoms of major depression first, because it's more than just being sad or having the blues. A lot of times, people who are feeling under the weather or just feeling down will think that, or they will say, I have depression. But that it's more than just feeling down or having the blues. People with major depression can't think clearly. They have a really hard time concentrating. They have a hard time enjoying things that they used to enjoy, such as hobbies or other activities, being around friends and family. They may think about death or feel suicidal, and I will come back to suicidal thoughts in a little while. They may feel worthless and hopeless, as though things won't ever change and they won't feel any better at any time. There's going to be a change in appetite or weight that would be pretty noticeable, and a change in sleep. Sometimes people sleep more, sometimes people sleep less. So if you have a number of those symptoms, then that might be indicative of an affective